We have seen just a very low level of influenza. We've seen approximately 300 cases of COVID-19 each week, and we're starting to see cases of pertussis increase in the jurisdiction. We've seen a total of 170 cases so far this year, January through here through the end of October. And so we're seeing kind of a mix of various respiratory infections so far this season.
Pertussis, which is known as whooping cough, is mainly found in young children and the elderly population. A large number of recent cases have been school-age kids and young adults.
Individuals who even if they've had the pertussis containing vaccine, especially if it's been a number of years since their last booster, are at risk of developing pertussis. The vaccine really does a good job of preventing disease shortly after it's been given, and that immunity does wane over time. But that's one of the reasons why we have pertussis spreading right now. Is it tends to spread every about 3 to 5 years, and it's been 6 years since our last large increase in the community.
Clayton explained flu season hits its peak in February, but influenza cases can spike with the holiday season. He says COVID-19 has been stable and somewhat decreasing over the past several weeks.
So far, since the beginning of the respiratory disease season in the first part of October, we've had nearly 2,000 cases of COVID-19, and that has included about 20 hospitalizations and 9 deaths. With our total influenza numbers so far, we've had 53 total cases, 3 hospitalizations, and 0 deaths so far. And with pertussis, we've had 170 cases so far, and that includes about 4% or about 6 individuals who have been hospitalized, and thankfully no deaths so far. To have the most protection possible, staying up to date with their vaccination, making sure that they're washing their hands frequently, avoiding people who may be sick, and if they themselves are sick, make sure they're covering coughs and sneezes and staying home, so that way we're not continuing to transmit or spread the infections. As individuals don't necessarily know what infection they have. And so it's important that you do your best to try and limit the spread to those in your household, friends, and other folks, because you don't necessarily know what you have.